The name of our program is called Trach TEAM Up, Tracheostomy Education and Airway Management, the UMC protocol. It's a comprehensive program that looks at the management of patients who have to have or may have to have tracheostomies. And as most people know, tracheostomy is a life-saving and sometimes life-changing operation that's designed to provide an airway in conditions where the airway has been damaged. In essence, what we would propose to do is to put in place some protocols to standardize how tracheostomy patients are managed in this hospital.
Having a well-organized, coordinated, multidisciplinary team that is protocol-driven, we can ensure that every tracheostomy patient gets the same care across the board, regardless of what specialty is taking care of them.
We have our physician champion, Dr. Pelaez, and we have our team of other otolaryngologists. And also, it's going to be a big multidisciplinary group of people who participate in regular conferences. We're envisioning that the conferences will probably happen on a monthly basis. Depending on the need and the frequency, we'll figure out if that's enough or too much. But the educational part is huge because that's one of the things that we know can really impact the patient's quality of life.
Every single learner at UMC is going to benefit from this kind of program because it is so heavily weighed on just education, what a trach is, how to take care of a trach, what's supposed to happen, learning the patient side of it.
When we talk about preventable complications, every time a patient has a complication that requires a trip back to the hospital, the emergency department, or the operating room, that's tremendously expensive, and the biggest opportunity is to prevent some of that human suffering.
Part of our Trach TEAM Up project, in addition to having standards and protocols in place, having educational modules for all of our providers, would also include a trach coordinator that can do daily rounds on all of our trach patients and ensure that the right steps are being taken in that patient's management. Our project here is an extension of a project that has already started at Children's Hospital with tracheostomy care and management there with the leadership of Dr. Adele Evans.
This has worked out really well at Children's Hospital, and we are actually envisioning this as something that could be extended across the LCMC system, which would be a distinctive program because, as best we can tell, there isn't any such organized program for complex airways and tracheostomies in the state.